Through the diagnosis, we have esophageal EGD, esophagogastroduodenoscopy. This is the gold standard and the most accurate method for diagnosis of what? Of the peptic ulcer disease. Is how do we see here an ulceration in the what? In the of the peptic ulcer disease. This is the normal lining, but here this is an ulceration, and here can be viewed well. But also we can assess the peptic ulcer disease by assessing for Helicobacter pylori infection. Through Helicobacter pylori infection, as how I told you, these are gram-negative that most colonizes the intestine. Sorry, not the intestine, the stomach. That colonizes the stomach. During the increased pH, these Helicobacter pylori are found to multiply, to increase in their number. Therefore, the Helicobacter pylori infection can be used in diagnosis as through serology. The serology, we have antibody-antigen interaction, antibody-antigen reaction through serology. Therefore, here we are tracing the antibody to see the Helicobacter pylori by utilizing the blood. Since the Helicobacter pylori causes an ulceration of the mucosal lining and may burrow into the what? Into the lining, to the blood capillaries, to the what? To the circulation. Therefore, we can utilize the serological test to find the what? Helicobacter pylori. But this method mostly are seen to occur for during diagnosing the patient or an individual who already exposed to Helicobacter pylori infection. But also stool antigen test. The stool antigen test is used for testing the current infection. That means the patient is exposed to, has contained the Helicobacter pylori in the stool. When being given the drug or medication, later to see an outcome also can be done again in order to see if the antigen are found in the stool or not found. But also we have barium swallowing. The barium swallowing is an alternative for what? For esophageal gastroduodenoscope. The esophageal gastroduodenoscope, which are being inserted through the mouth, in the esophagus, the stomach, and the duodenum for diagnosis of an ulceration. Let us see on the treatment. The treatment of peptic ulcer disease, it depends on causes. We are treating the peptic ulcer disease by seeing firstly on the causes, by determining the etiology as the key to remove the causes. We can utilize three methods: the surgical method, medication, and therapeutic. The surgical method is done for the patient who have very deep an ulceration. For patients having deep an ulceration, those who have very deep an ulceration, that an ulcer or lesion has damaged the epithelial lining, of the stomach, entering deeper into other tissues. It is where a surgical management can be applied so that to treat the patient. But also we have medications. Through medications, I will not go so deep here. We will go to see more in detail on the therapeutic treatment. Therapeutic treatment is an our part through peptic ulcer disease, because as you know, the food is medicine. The food is medicine. Also here, an antibiotic, we are using the antibiotic against H. pylori bacteria as amoxicillin, clarithromycin, and tetracycline. But also we can utilize acid-lowering medication. Here we have proton pump inhibitor that function on lowering acidity of the water of the stomach, as we have omeprazole, lansoprazole, rabeprazole, and pantoprazole. Those are surgical and medication on how we can treat the patient. In the therapeutic treatment, we are going to see it in the second presentation. Please be with me so that we get a lot of information and more understanding on peptic ulcer disease. It is true, food is medicine. My name is Nasir Eric Morishidi. Thank you for listening, but please like, share, and subscribe my channel so that to get more earning and to get more advantages. Thank you.